Good evening and welcome. I'm Dr. Jack Tips, and I'm going to share a few things about working with the systemic formulas, and particularly for the heart, the cardiovascular system. And so let's just jump right in and get started. This is going to be a little bit more like a class rather than just a lecture. So we're going to roll up our sleeves. We're going to be looking at formulas and protocols. And one of the really wonderful things about working with the heart is the heart repairs so quickly. You can just imagine in nature that you've got one heart. It's got to be pumping, practically every second. And throughout all of nature, organisms that have hearts, it's virtually the instant of life every time that heart beats. And so it's critically important, and the body knows this. So one of the features of the heart is that it repairs. It repairs itself between every beat. It's constantly in a mode of making energy, use some to repair, beat, make energy, and keep this whole process going. And we know that the heart just keeps on ticking. The old study of the gentleman who kept the chicken heart alive for 20 years or something, I get different stories and different statistics on that. But basically, our heart is made with a quality of a pump that is just self-perpetuating. So why is heart disease often, usually, the #1 killer? I know of Americans, it changes, it seems like each year. One year cancer gets a little bit higher, another one heart disease. But right now heart disease is winning the kill the most people contest, unless you look at iatrogenic disease, which according to Dr. Gary Null, there's over 750,000 people a year that die from either medical interventions or the wrong medications or drug interactions and so forth. But the statistics are kept differently, and so it's not that great of an honor to be #1. But we're going to say right now, heart disease is #1 killer of Americans. And you know what that means for our clinical practices? Because we have answers. We have preventative and definitive answers for heart disease. It means that we should be working with the heart formulas every day in our clinic. There's hardly a person that comes out that wants to see a nutritionist, particularly for heart concerns, that doesn't need to get involved in these formulas. And I'll tell you, Systemic has some beautiful formulas to manage the heart. Anytime I get a call clinically and someone says, I just had a heart attack and I've really gotten a wake-up call and I want to do whatever it takes to get my life and health back. And a lot of times these people feel so absolutely miserable on the variety of drugs that they're given, and they're concerned about the horrendous side effects of those drugs. And so I love getting people like that who are compliant, who are very dedicated to having their heart get better. They're going back to the cardiologist, so the scorecard's going to be running because the cardiologist is going to see through the lab work that they are getting better. And so I would say, generally speaking, for over 25 years, I have enjoyed working with heart concerns. Anything from congestive heart failure to the arrhythmias, to circulatory issues, atherosclerosis, arteriosclerosis, and even some of the inflammations, the pericarditis, the myocarditis, and so forth, respond beautifully to natural diet, natural healing directives, and to these formulas. So we're going to look at 4 formulas right now. This is the core. These 4 formulas are needed for any and all heart cardiovascular issues. These 4 formulas should be on our natural health clinical shelves by the dozens. They're so greatly needed. And we're going to take a close look at these formulas. The H, heart formula, the HCV, heart cardiovascular formula, the HQ, wow, this is a marvel, the HQ, heart energy formula. Everything that we were struggling with as far as having to give people wheelbarrows full of supplements, carnitine and coenzyme Q10 and magnesium and so forth, ribose, all for the heart. They're all in this one formula. What a blessing. And finally, vitamin D. Vitamin D is coming so much to the surface, and I'll tell you, right behind vitamin D is going to be vitamin K. Not just for bone, but for the heart. So these are the formulas that we're going to call the core formulas, the core. That means no matter what it is, with the heart, with the cardiovascular, those four formulas throw a blanket over all of that. The only thing we want to do with those four formulas is then maybe if we know more knowledge about a condition, we want to focus in, and then we will add to them and add more things that are, let's say, more powerful antioxidants, more anti-inflammatories, heavy metal detoxifiers to clean out the cause of why there's so many free radicals. That exercise and diet, and we have a recipe for wonderful clinical success. So let's look at the heart formula. We'll go to the next slide, and we'll look at the heart formula now. The H, heart. And if you take a look at the slide that's up, Doc Wheelwright gave this formula a biosignature of 72,909. This is a biovalent wheelwright. This is when he did his bioenergetic testing. And this was the target as he put his formulas together. He knew that he needed to be in this energetic range. And so we're going to find in the heart formula, it has an amino acid matrix. Doc loved to work in these packets or matrices. Phenylalanine, L-carnitine, tyrosine, big amino acids for heart health. And we're going to look at the mineral matrix. There's the calcium, the potassium, the chromium. You think about the relationship between glucose and diabetes and heart, right? The diabetes diathesis is simply heart disease in a nutshell moving toward cancer. People don't get cancer of the heart so much, right? But the diabetes diathesis goes into cancer, and a side effect of diabetes, it instantly goes, right? It's the same cellular story about heart disease, so they are hand in hand. You'll see that there's a lot of the B vitamins and the B lipids as far as choline and inositol, and of course the lecithin, B1, B2, B6, the folic acid, the biotin, and the niacin. Now we also have on the next slide, it's continued, you'll see we also have the cellular identity factors there, and Doc Wheelwright chose the heart, the thymus, and the spleen. A lot of times we don't know quite why Doc picked what he picked, but you'll find that that when you take the triad, particularly of the tissue integrity factors, that it's uplifting to that tissue, and it allows the body to focus on rebuilding that tissue. And it's got an herb base, the hawthorn, the tayuya, the setisangrius, and the woodruff. Now, if we go to this next slide, we're going to start taking a look real briefly at some of these herbs. Tayuya. Wanted you to get a chance to see this herb. It's one of the miracles out of the rainforest of the Brazil. It's a tonic, a blood cleanser. It's anti-inflammatory. It reduces pain. It gives nerve support. It's full of antioxidants and phytonutrients. It tones muscles, hence the heart muscle. It's going to have a tonifying, supportive, strengthening effect on the muscles. And it's anti-convulsive. If you want to think of convulsions being a nerve overload or a nerve charge, look at how this all relates to the heart. Now, in citing these little bullet points about these formulas, I want you to know that I am not making these up, that I sat for hours on, thank goodness, the internet, and I looked up and I found studies, research studies, and or long-term ancient tradition on these topics. So I'm not throwing topics out in wishful thinking. Most everything, at least 90% of this, and then some things come out of the herbal lore and legend. There's clear research studies. A lot are done in Brazil, some are done out of Germany, and there's even U.S. studies that back up that these herbs have a profound effect on the heart and cardiovascular system. Going to the next slide, we find Setisengrius. And it lowers high cholesterol. It lowers high blood pressure. It lowers high triglycerides. You know, right there we can start getting a sense that this is going to be a glucose metabolic formula. It soothes nerves, calms palpitations, anti-inflammatory, and it's used in Brazil for arteriosclerosis, and of course it's used for atherosclerosis as well. And so when there's the plaquing and the oxidative damage to the arteries, this is an herb that comes to bear and helps clean that up and helps relax the inflammation. Woodruff is an herb, and I met woodruff once over in Germany back in 1970. They literally put this very fragrant, aromatic herb, they soak it in some alcohol and even the May wine, and it makes a very floral, fruity, and they put strawberries in it, and they make a little sangria type beverage. So woodruff is often used for even dietary purposes. It purifies the blood. It's an anticoagulant support. Why would that be important? Because people with heart difficulties run a much higher risk of getting strokes, of getting a blood clot in the atrium of their heart, having it clog something up, or from the pumping to the brain, it can send a clot directly up to the heart. And so keeping the blood thin and free-flowing is really important in medicine. And all they have in medicine is warfarin and things like, well, the Coumadin, which is warfarin. And there's horrendous side effects to that medication. And you know what? Nattokinase, when we talk about that, actually has scientific research studies showing it performs better than the warfarins and the other blood thinners, heparins and so forth. So we have a natural enzyme, natural product that actually performs better than the drugs. But of course, millions of people who are paying high prices for drugs don't really find out about that. So they use woodruff for phlebitis and varicose veins, and it's anti-inflammatory, and it tones the blood vessels, strengthens the heart, and it's full of antioxidants. So you can see how these herbs that Doc Wheelwright put together are approaching the heart through the vascular system, and there'll be some pulmonary support, and the nerve system, and the muscles, and he comes at the tissue from a variety of areas, so he has very comprehensive support with the formula. Hawthorn has to be the leading, one of the greatest herbs for cardiovascular health, both the arteries, the veins, the capillaries, and the heart itself. The research on hawthorn is phenomenal. It purifies the blood. It normalizes irregular heartbeats. It reduces chest pain, protects against heart disease, lowers high blood pressure, prevents hardening of the arteries, and prevents heart failure. Now, if you pay attention to what these herbs are shown to do, you can start thinking of how diseases are named. In other words, irregular heartbeat. Well, that could be tachycardia, that could be atrial fibrillations, the chest pain, the anginas, the heart disease. When it prevents heart failure, we can be thinking of the congestive, prevents the hardening of the arteries. And so we can see how this whole constellation comes together. In the next slide, we're going to now take a look at the heart cardiovascular formula, the second one of our core. And so we're going to see here that it's got some of the similar ingredients and some of the same, like the Setisengrius. I won't talk about that again. And I don't talk about every ingredient. I'm just going to highlight a few so you can get a feel for what this formula does. I have to admit there was a time that I put some of the formulas under my pillow and I just wanted to sleep on them to get a feeling. I took the formulas myself, and it was sort of this immersion of getting acquainted. And that was an idea that Doc Wheelwright made me do. So you can laugh, but I'll tell you, it gave me a wonderful affinity and a wonderful feeling and empathy regarding these formulas and when they can truly be effective for a patient. So here we go. Cassia bark, You know, you probably put this in your apple juice from time to time. It looks like cinnamon, doesn't it? And that's because it is cinnamon. So it's a type of cinnamon bark, and most people know cinnamon also has a powerful effect over glucose regulation. But it also purifies the blood, lowers high blood pressure. It's full of antioxidants that can help lower high cholesterol. And so when cholesterol runs excessive as a body response, we know not to bash cholesterol. In fact, coming from this webcast, you're going to be able to download an article. I almost changed the title. I wrote the article in 2001, so it's 11 years old. And I read through it. It's still true today. And so it's just 4 pages, but I almost changed the name to Cholesterol is Your Friend. If you listen to the webcast, the prior webcast from Dr. Daniel Pompa, you got an idea of how cholesterol is so far off the mark as far as being any kind of public enemy. It is our friend. But when we talk about lowering high cholesterol, we're talking about the body may have lost some of its checks and balances. Cholesterol is running too high. Why? Because the liver's making it, the cells are making it. They're not talking to each other properly because there's cell membrane confusion. The communication systems are off in the body, and the body's using cholesterol as an anti-inflammatory. So the cholesterol is trying to protect us. So we don't really want to consider taking the statin drugs and all their side effects when cholesterol is our friend, and we need to go back and correct the cause. These herbs in this type of program, if cholesterol is unduly excessive, it will help the body understand that and lower it. Then there's less cholesterol to oxidize and cause cellular damage. Another way of approaching it would be antioxidants, wouldn't it? And then the cholesterol wouldn't oxidize in the first place. One of Doc Wheelwright's big discoveries was pimiento. He found that the pimiento has one of the higher etheric vibratory rates of any herb on the planet Earth. He put it up in the 1500 BVW, as you see here. And this is the pepper. This little heart-shaped pepper. Sometimes they grow a little longer, more like a chili pepper. It's not hot. It's a sweet pepper. It's a delicious dried pepper, and it's a powerhouse of nutrition. So just taking the HCV formula is a wonderful blood purifying boost. It's full of the flavonoids, some terpenes that fight inflammation. It has antioxidants, anti-inflammatories. It's got nascent potassiums and magnesiums in it, which means we're giving the body some of the electrolytes it needs to run the heart's electrical system. Normalizes blood pressure, but most importantly, it protects the integrity of the arteries, the veins, and the capillaries. So now we could be thinking varicose veins, atherosclerosis, arteriosclerosis, inflammation in the arteries. This is what's at stage here. And this is just a wonderful food, herb that has this beautiful effect over the heart and the cardiovascular system. Vitamin D3, it protects the heart vessels. It lowers blood pressure. It regulates glucose. It prevents arterial calcification. Now, you have to have vitamin K2 with the vitamin D in order to prevent the calcium. It's going to keep that calcium from going into the arteries and sticking and turning into cement, and then you have hardening of the arteries. It's going to take that calcium and put it in the bones where we want the hardening to occur. So our bodies have cement in liquid form floating around in it. We don't want it in the arteries. We do want it in the bones. It takes vitamin K2 to do that. And it's also very helpful when doing this is to take it with other fats. Again, it's protecting the arteries. And finally, our fourth product, the vitamin D3. I'm just going to take a little sip of water. Thank you very much. In the vitamin D3 liquid, we find vitamin A, the synergist of D. we find the K, an absolutely essential component of vitamin D supplementation. And so from this perspective, it's all put together here. Brilliant formula. We're going to find here it has the calcium, magnesium, the potassium, the zinc, and the trace minerals already in this product. It's got some of the cellular identity factors. It's got some wonderful nutrients. You've probably heard of beta-glucans and how they work on the cell membrane, and they're often people often supplement with beta-glucans to prevent cancer. Grapeseed extract not only preserves it, but it also is a powerful antioxidant. Malic acid. These things work, particularly the malic acid can work in the gallbladder, making sure that stone does not develop. So it picks up a little bit of here the amino acid carnitine, and we're going to talk a little bit about the herb base for this formula. On the next slide, we're going to start with the Eleutherococcus root. That's just a big name for a type of ginseng. So it's an adaptogen. It helps with not being too stressed. It reduces fatigue, and it builds the immune system. This is wonderful research on this root. This type of ginseng, that it activates the killer cells that are going to be able to take down viruses and bacteria throughout the body and make sure that the cells don't go rogue and with oxidative stress. It supports the endocrine system. It can lower stress hormones, prevents heart disease, improves memory, improves low libido, and repairs oxidative damage to cells. Just a few reasons why vitamin D, and particularly now that we have the ginsengs in it, we have a combination that the herbs are strengthening and supporting the matrix for the vitamins. This makes the vitamin D3 liquid by systemic probably the most superior. I've never seen one better. It's what I use, it's what my patients use. This liquid vitamin D is the way to go, and you're not running the risk of creating a relative imbalance with K and A because it pays homage to those. It has the ligustrum fruit in it, which detoxifies benzene. Now, benzene is a powerful carcinogen. It's throughout our environment. People use benzenes in industrial capacities. They use it to clean equipment, this type of thing. And the benzene molecule can lead very quickly into things like leukemia, forms of cancer, lymphatic cancers. So isn't it nice to take a little vitamin D each day and get protection should you run into one of those volatile chemicals? It tones the blood, nourishes the liver, supports the stomach and bowel, heals ulcers, strengthens the heart, boosts the immune system. It has antimicrobial, anti-inflammatory. That's on the base with the vitamin D. A lot of people don't know what Morris root is, but it's sort of the mulberry. It's a white mulberry. There's many colors of mulberries, but there's a Himalayan mulberry that's particularly potent with the antioxidants. And this is where we pick up some support on the pulmonary system, which means we're not ignoring the run from the lungs to the heart. As we look at this blanket program, remember we're on the fourth formula of this blanket program. Fights arterial plaque, antioxidant, improves high cholesterol, prevents atherosclerosis, improves cholesterol ratios. Nice little herbs to have coming. And I'm sorry, now I'm looking at the fourth. That was the third. The HQ Heart Energy formula. This is the fourth product. We have the H, heart, HCV, the vitamin D, and the HQ. These make up our core of, if anyone says, I have a heart cardiovascular issue, you give those four formulas. Look at this huge blanket you're throwing over this net, over all these nuances that comprise problems that can occur with the heart and cardiovascular. Okay, the Heart Energy has minerals like magnesium and selenium. It has vitamins such as vitamin E, the niacin, the K2 in the MK7 form. And vitamin K comes in, maybe like 6 forms, maybe even 7 forms. I'm sorry, I don't know the full number. Some of them are numbered, like there's a MK7 and MK6 and MK2 and this type of thing, is they differentiate the activity and the viability of the molecule. The 7 molecule is vitally active, and most importantly, it's the form of vitamin K that supports the muscles and the bones. And so it's engaged in the skeletal muscular system. And while we're particularly interested in the muscle system for the heart, it has heart and adrenal cellular identity factors. If you think of the adrenals kicking out adrenaline and the heart immediately thumping at a much faster rate, now you can understand, I hope, a little bit more on why these types of factors are so important. You can't get them at a vitamin store. People are not getting them in their diet, and you know what? You don't get any of this through the pharmaceutical drugs. And look at the answers that we're finding here. It's got the fatty acids, the enzymes. Now we're going to be looking at the nattokinase, the coenzyme Q10, and it's got a little hawthorn and the cinnamon and some herbs. I'll talk about blueberry since we haven't talked about that one. The next slide, we're going to look at coenzyme Q10 here. And the coenzyme Q10 with systemic, thanks to Dr. Shane Morris, he takes the ubiquinone, makes it water soluble, gets a very high assimilation rate. Once in the body can determine what to do. If it converts it into ubiquinol, where it will serve in an antioxidant capacity, or will it serve a cell membrane capacity, or will it serve a Krebs cycle energy capacity? And so I find a lot of people are misled about ubiquinone, ubiquinol, and the ubiquinol is being touted as an expensive, superior one, and it's maybe superior in an antioxidant capacity, but there's other roles for coenzyme Q10 to play in the body. So we want to give the starter in a high uptake form and let the body determine. Now, elderly people have a harder time converting ubiquinone to ubiquinol, and they're the ones that most often can benefit by paying the really high price for the ubiquinol. And so coenzyme Q10 works with L-carnitine, and it's going to help normalize the ATP recovery. So for the heart has to make energy, and we have to understand that that left ventricle has got to pump blood all the way down from the tip of your toes up to the tip of your nose. It's got the big job, right? The other shots are the pulmonary, very short hose, and up to the brain, not a very far run. You know, the further a fluid is moving through a hose, the more pressure you have to pump it. It's called, like having a pipe size and pumping water uphill. You've got to have a lot of pressure. And so the left ventricle has to recover instantly. Boom, more ATP, more ATP, more ATP every time. And if it starts running short, there's horrendous problems and heart disease. And so energy is everything, and getting ATP for the heart is what is so important, because when we give the ATP to the heart is then able to take that energy and not only make more ATP, but it's able to repair itself. So many people's hearts are dying just because they don't have the nutritional funding. They don't have the ability to make the ATP. Then there's damage going on from the environmental toxins. And if the DNA gets damaged, and the mitochondrial DNA, and it does not perform right, then our cells, instead of having 4,000 to 6,000 mitochondria making ATP, maybe they only have 3,000, and the system is stressed like a small car going up a hill all the time, and people feel bad, and they're starting to develop heart disease. And so coenzyme Q10 reduces heart attack reoccurrence, scientific base, helps prevent congestive heart failure, scientific studies, lowers high blood pressure, lowers high cholesterol, prevents the diabetic heart. If you know someone with diabetes and they haven't gone into heart problems, they're a candidate for the HQ formula, literally to take it every day. Protects the heart from chemotherapy. So now, boy, if only we can provide our nutrition for people who choose to go to chemotherapy. We can do so much good. The recovery so fast. It's become common in programs that I oversee that people undergoing chemo don't even lose their hair because we get their nutrition right. Now, we're not counteracting the chemo. Most often the doctor has to approve the supplements. So it's just wonderful things can be done. Why are the dietitians in the hospitals not doing programs like we can do? It's a heartbreak. Normalizes arrhythmias. Nattokinase. If you're not familiar with nattokinase, I've already talked about it a little bit. It actually has a better track record than drugs for keeping the blood thin and not going into clotting. That can cause strokes. It lowers high blood pressure. It dissolves fibrin. It helps avoid deep vein thrombosis. It prevents the angina, improves varicose veins, reduces hemorrhoids. Look at all the reasons why this might be important. Anti-aging effects, and it's a source of natural vitamin K2. It's where the K2 comes from. It's a soy derivative. A bacteria ferments it, and you see that gooey part in the slide. That's where the good stuff is. Turns into this gooey stuff. A lot of people in the western areas don't particularly like eating it, so it's easier to take in a supplement. Oriental cultures like it. Now, the vitamin K2 prevents arterial calcification, prevents cardiovascular disease, prevents varicose veins, mobilizes calcium, decreases cholesterol, removes cholesterol deposits in the arteries. Wow, is this going to be an important formula? This is the HQ, and now we can start actually reversing some of these arterial problems. It's not contraindicated for people who are already taking blood thinners. It reduces the risk of cancer. D-ribose. It's a saccharide. It's a polysaccharide. It is the perfect fuel for the heart. You don't get much in your food. This is something that's concentrated, and it helps the mitochondria produce ATP. It strengthens the heart. It helps recovery. It's being used for chronic fatigue and fibromyalgia. It improves the blood flow to the heart. It's an anti-aging nutrient. It helps recover energy, and it's a major importance in congestive heart failure. And so this HQ Heart Energy formula is seeing that the mitochondria can make ATP, and that energy makes the heart work better, and that energy is needed to heal the heart. People need to take HCV just to take care of their hearts, much less try to reverse damage that's already done, and it has the ability to reverse damage that's done. And the next slide shows the blueberry. And I don't think we eat enough blueberries personally. You can buy them organic frozen and just eat them all year long, and it's certainly a wonderful treat. Lowers high cholesterol, lowers high blood pressure. It has the anthocyanins in it, the antioxidants that specifically support the heart and specifically support other tissues throughout the body. It's known to have anti-cancer factors. It's full of antioxidants, stabilizes blood sugar. Blueberries are fine for diabetics. They do not have a lot of sugar. You have to eat a lot of blueberries to get a wallop of sugar from it. Lowers the risk of strokes and intones the vascular system. Now, for fun, let's take a look at something here. Here's the special. Systemic has this special running all month long. And it's if you get an H, an HCV, and an HQ, just one of each, they automatically give you the DV3 liquid for free. Nice. You can buy as many as you want, and you can do it all throughout the month. This is our core. This is what's needed. You will not have a person walking into your clinic that has any kind of blood pressure, cholesterol, heart, arterial, capillary, hemorrhoid, varicose veins, and or diagnosable heart concerns like tachycardia, atrial fib that don't need to be on these formulas. So you can't get too many of them. You're going to be using them. let's move on a little bit more here because, next slide, we know we have the core special. I had fun with this, but wait, there's more. You're going to get 2 research reports. You're going to get that cholesterol myth research report that I cited, but you know, that's only 4 pages, and I know some of you just love to read and learn, and so I'm going to give you what I call schematics, and on the HQ formula, I'm going to take each ingredient in the HQ, and I'm going to write down the research and what it does, and then how it all comes together. That's a 21-page report. It's got some illustrations. It's not going to tax your brain to skim through it, but I think you're going to find it to be very valuable because you're going to understand the genius that went in to making that formula and why it is absolutely essential formula, and we really need to have this type of formula. You know, I could say virtually in every program that we do. If I haven't made that point clear yet, I did not do a good job in communicating. There's just not a person, an adult, who doesn't need to be taking HQ from time to time, and a lot of people should be taking it every day. Let's jump into some protocols now. We're going to roll up our sleeves. Now, what do we do about hypertension? Let's look at some things here. We need to reduce insulin resistance because the insulin's presence in the bloodstream too long causes that smooth muscle to enlarge. It makes them bigger. And when the arteries get thicker, the smooth muscle, the blood pressure goes up. So as long as people are eating sugar, they're not going to have good solutions with high blood pressure. Oh, you know what? They can keep eating sugar and just take the meds with all the side effects and rot their livers out, but they get to eat the sugar along the way, which will also have pretty much damaged the liver and the pancreas as well. So people really need to knuckle down, and we need to explain this to our patients. You can either keep doing what you're doing, throw it under the rug with a drug, and die young, or you can make a change today. And that change today is to embrace the diet, the exercise, and supplements of natural health. And I'll tell you, there's nothing better than an alert, alive, awake, feeling good feeling that comes with natural health and the body manifesting its innate vitality. We've got to lower inflammation. That's what also is causing the arteries to plaque up. And it's causing the cholesterol to oxidize from the free radicals. And so we've got to do something to lower inflammation. And the kidneys have at least a 50% say in what the blood pressure is. And so when the liver holds the blood and can take volume out, the kidneys have everything to say about blood pressure because they're controlling the water. The liver can control the blood. And there's a sensor in the brain that also controls blood pressure. And we know the adrenals are kicking into the loop so that we don't get the syncope when you rise up from laying down. Now, we have to support arterial nitric oxide because that dilates the vessels so that they don't have hypertension. And we have to support the heart because anything that goes wrong in the cardiovascular system is inevitably affecting the heart with the same story. So we can consider it separate, but we don't have to. And it's going to calm stress, and then the detoxification program. We have to get rid of the source. And it's the things like pesticides, heavy metals, is a primary source of inflammation throughout our bodies. Let's look at the program. Now you're going to see here we have the core. And the core is going to be in every program. And if all we did was the core, we already have a great program. We're going to enhance it because we can. And here we're just simply going to give the kidney S. That's going to have the kidneys do their work better. We're going to give Aventa, which is the arginine push into the nitric oxide. So we're going to make sure they can dilate the vessels and the capillaries, and the heart needs that nitric oxide too. And we're going to look at the Vista because of the 4-to-1 ratio on the EFAs, the essential fatty acids in it, and we're going to have that. Now, if we go back over the first 6 here of the reasons, embedded in this program are solutions for all of those. And all we had to do was apply 7 formulas, a reasonable program, just a couple meals a day. You eat 3 or 4 capsules, and on you go through time. And then with a proper diet and a little exercise, hypertension can start to fade away. Sugar would be an enemy of that. Another protocol now, the next one, hypotension. We don't see that so much, but when people have it, a lot of times people don't know what to do about it. The key is probably the adrenals. And so we're going to be looking at our same core program because it takes energy to run the blood pressure properly, and it takes, well, the ATP has to be behind all of this, and so that's why the HQ comes to bear. And then we're going to have the formula that Doc gave us, the heart cardiovascular, which is directly for the arteries and the integrity of the arteries. And here's something I didn't mention on the HCV formula. It's made for the integrity of the arteries, the veins, and the capillaries. It's not a cleaner outer, only a cleaner outer of what's in the bloodstream. It's actually the only formula I know in the whole world that supports the arteries as a tissue, and that means the integrity gets built up. Doc Wheelwright had a friend who went and got chelation, and it stripped off some of those scabs, the arteriosclerotic scabs, and he blew a leak and died. And Doc said, it only makes sense to first support the integrity of the arteries. Support the arteries as a tissue. Make them strong from the inside out. Then all of this that we do through the bloodstream to clean out and everything, if someone is going to go do chelation or something, then it's much safer. So here we're going to simply add the adrenal formula to our core, and we have a hypotension program. Myocarditis, number 1, support the heart energy, reduce inflammation. That's what myocarditis is. It's inflammation of the heart muscle. And a lot of times this comes from pathogens. And so, well, I'm going to have to take another sip here. The left-hand side of this slide for your review is just showing all the pathogens that are known to cause myocarditis. And so we're going to take our core, because the heart needs energy to overcome the inflammation. It needs anti-inflammatories. And so we can see how the vitamin D and these formulas are all going to be a big part of this. But we have a program called the Pathogen Purge, and it's something that you can download from the media site, and you can also receive the protocol. There's a printed protocol that can be sent to you by email, but it's a way to go into the body and in 10 days wipe out the virus, the fungus, the bacteria, the mycoplasm, the things like candida, which is a fungus, or even in the yeast form. And so if all the pathogens, except for like large parasites, are dealt in the pathogen purge. And from that, you're able to do a clean sweep, and it's a very valuable program when anyone has an inflammation based on pathogen presence. That's different than an infection. It's the inflammation based on the excrement of the pathogens, and the pathogen involvement in the tissue is launching an inflammatory reaction. We also have here the ROX and the EPIC. Both of those are antioxidants, one for inside the cell, one for everywhere else. And when we bring in those antioxidants, we start to quiet down some of that inflammatory response. And if you have other inflammatories, certainly this would be the time to use them. Let's look at the tachycardia and atrial fib. Now these are often more considered the electrical system, and we have a formula. Doc Wheelwright made a formula for this specifically. It's called N-nerve. It supports the heart nerve. It supports the bundle branch. Here's a heart, and it's not going to really reveal there's nerves that come into the right sinus of the heart, and from there it gets a burst of electricity through the atrium. And then that energy has to go down, and it goes through a gatekeeper so that there's a good thump in the ventricles. So it's lub and dub, I think is what they call it, the lub-dub of the heartbeat. And so this electrical system is what's addressed nutritionally by the N-nerve formula through B vitamins and the phospholipids and so forth. And this program with our core is rich in the phospholipids that support these nerves. What we want to do in a program that is involved in heart rhythm issues is we want to get enough potassium, and we want to, particularly potassium, and we want to get enough magnesium, and make sure, of course, they have calcium. These are the electrolytes that run the muscle, and then on the sodium, potassium, and magnesium also help with the nerves. So these are the electrolytes that are needed. Now, if someone has weak kidneys, they're flushing their electrolytes out. I've had people tell me that they have a tachycardia, and in looking at blood work, they don't have enough potassium. And yet, sometimes these people are taking potassium as a supplement. I said, oh, don't sell me any potassium. I have a bunch at home. I said, yeah, but you don't have enough in your body. And so why? They're taking it. Why aren't they keeping it? Well, the kidneys are spilling it out. Maybe the adrenals are weak, and the hormone aldosterone is not holding the minerals. And so now we find that the kidneys are related to the heart. And I'll tell you, Chinese medicine has been telling us that for 5,000 years. Maybe it's about time somebody in this country started listening to that. The kidneys and the heart are buddies. And so here we're going to add the nerve formula of the potassium, the PTM, and fire sedate. It's one of the Chinese formulas, but when someone is having tachycardia or atrial fib, it's an overabundance. It's what they call excessive fire. It's an overexuberant condition. And Doc gave us a Chinese-based formula called fire sedate. And fire sedate is going to quiet down the overexuberance. Maybe you've been in a restaurant, and everybody's sitting, everybody's talking and laughing, and everything's running smooth. All of a sudden, you get a really loud, boisterous voice. Somebody doesn't have good manners, somebody getting a little tipsy, and their voice goes so loud and they become really obnoxious. And you'd say, if they would just quiet it down a little bit, they'd blend in with everybody else and they could have all the fun they want and not be annoying. So this overexuberance of the heart is annoying. People feel horrible when they have it, and it's scary because they think they're having heart attacks. And what's really needed are the electrolytes to support the process, and that they're not running on adrenaline. In the next one, we're looking at poor circulation, and here we pick up atherosclerosis and arteriosclerosis. You have some pictures here of the lining of the blood vessels swelling with inflammation and cholesterol deposits that get oxidized, as well as the building up of plaque inside the arteries. That's atherosclerosis and arteriosclerosis. Here's our plan: support the heart energy, support the arteries, veins, capillaries, reduce oxidative inflammation. And of course, why is there having problems in the first place? There's inevitably toxins involved in there that are triggering more of the detox. They're triggering the body's response. It's free radicals. We've got to get in and detox. And so anyway, here we have our core program, and we're going to use Roxin Epic. Again, our anti-inflammatory antioxidants. And we want to bring in the fatty acids. There's a nice blend in the OMGA. And so this is going to give a nutritional base for the body to start repairing. We already heard how some of these formulas can actually help repair their components. This next slide shows you what we've covered. That we've covered that there is a universal core. You see the 4 formulas listed there in the universal core. If a person has anything, that's why it's yes, 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 all the way down. If you can name the condition, yes, those 4 formulas are absolutely needed. And then you see there's targeting formulas that we talked about, like for hypertension, the kidneys, the Aventa, and the Vista come together and make a total, well thought out program that gets quick results. And so this is a little chart that can show you the relationship. And remember, this universal core is already on special. It's on special all month with systemic, and you get the free vitamin D, so that's just wonderful. And then you can look at these other formulas that you should pick up in your inventory, and I've got a secret surprise for you now. The Speaker's Special, and I picked the top 3 of those other formulas. The Aventa, the in-nerve, and the kidney. So you see you're going to cover hypertension very quickly here. That's one of the big things we see, right? There's some 25 to 30 million people that are hypertensive, and the number's growing all the time. So here's you a special that you can, if you buy 3 of any one of these, or all 3, or whatever you want, mix and match, you buy 3 of those, Systemic is going to give you another one for free. It's a great chance to load up your inventory. Now you might be wondering, why do I have this here? And somehow, in rushing headlong through our subject matter, I didn't come to the board. And if I don't come to the board, I'll look like a dunce for having a board and not using it. So I wanted to show you something Doc Wheelwright taught. We have the arteries here, and through the marvels of technology, we're just going to move it in a little bit. And Doc taught us that in these arteries, the right side here is on the left, by the way, if you recognize the heart, but the heart has to feed itself with the coronary arteries. And here's one of the problems that come from that fear of clotting. Now, in an earlier webcast, we talked about how the coronary infarction is not the primary cause of heart attacks and death. It's degeneration of the heart muscle from a lack of ATP energy and from toxins getting in there, and that's why we need to detox. And that's 75% of the deaths are not even addressed by the cholesterol obstruction theory. And we talked in that also about the collaterals, that if the heart starts getting obstruction, it just sends out more and more and more little blood vessels. They look angiogenesis, they grow there, and the heart is very much ensuring. In these blood vessels, Doc explained that they often have a little chamber as they feed the heart, and if there is a blood clot, it will get trapped in this chamber, and it has trouble getting through. And in here, as the blood comes through to nourish the heart, this clot can stop up the hole. The heart will regurgitate, kick it back, and this thing bounces around in here. And so you'll have people who you listen, and oh, you've got tachycardia. Oh, you have an irregular heartbeat. And they're listening here. Oop, 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 there's a jump, there's a regurgitation, and then it's all, you've got heart disease. You have to go on drugs, and all it might have been is a little clotted area that's being dissolved. You know what dissolves this? The reason Doc made the formula HCV was to literally day by day be cleaning the arteries while supporting the integrity of the hose. And that's just a little example here of how when we take these formulas, we start rejuvenating our body from the inside out, our waterways, our bloodways that start getting cleaned out, reduced inflammation and integrity. Every one of us, me included, need to be on the 4 core formulas, and we better be doing this about every 6 months. With the onslaught of heart disease and its environmental factors and it's things that were beyond our control, our hearts are under attack. We must do something about it. Systemic Formulas gives us the best of the best in order to do this. You'll see the results in your clinic. Thank you very much.